Thank you for joining us today. We're going to share with you a workshop that's going to help you answer an age-old question. Is our hand wash good enough? Is it the way we want it? Or might there be some improvements we should be looking at? The way we're going to do that is to conduct a workshop. This is a collaborative workshop, an internal one, for you to gather up people that really understand your business and take a close look at the hand washing and help decide a common number for the risk. So we start here with assessment of the risk. This is our process basically. We call it the circles of success. And this system is what we've used in all our studies to say, let's start there because everything compromises, etc., that might be made along the way. We want to go back and check the risk. The next thing we need are safe level standards. We need standards in order to set the tone for the whole process of improving hand washing. The next thing, we optimize. Make sure we're setting the conditions for success here. We want the staff to wash more. Make sure that products are reliable, dispensers are reliable, that everything is working as well as it can be, and optimize the various components. The fourth step is to train and motivate. Now, this is one where normally, as soon as you suspect that hand washing is low, let's have some more in-service training. It might bump up, but there's such a thing as a ceiling for training, and we'll talk a little bit more about that in a couple of minutes. The fifth one is monitor. Yes, this happens to be another one of those areas where what gets measured gets done. So what we have here is a collaborative way to pull together and come up with a standard risk number. And we're going to move through a couple of quick exercises, and let's move on to the first exercise. Our first exercise we call the hurdles, the hand-washing hurdles. Over the 16 years of our research in the area of hand washing, particularly on the frequency, we find that almost every single one falls into one of these 5 hurdles. One of the first ones here, executive awareness. Do the people in the C-suites really understand what's going on out there in the units? They view it as we've got staff to handle those things. They might not even be aware of what's on your mind about hand washing and some of the suggestions you might have. The next one is the operational priority. In the short term, with patients and residents looking for attention and care, to wash your hands and disrupt that flow seems unnecessary. So the rush versus the risk, it's a hard one to answer, and it's something we always have to constantly look at. The third one is the environmental barriers. Are there actual environmental barriers to good hand washing? Are the sinks close enough to the bedside? Do we have everything in the quality of the products that we're looking for? Is the reliability there? So this is an important area. And then the caregiver commitment. The caregivers are well trained, but are they well motivated? Do they know how often we're expecting them to wash their hands? And finally, the scorekeeping. Without data, we have no reports, we have no rewards, we have no way to discipline those that aren't performing. So that scorekeeping is an important issue. Now, in the previous ones that we've done, we find that the key area here is these two, and that is the executive awareness and the operational priorities. And so we find that they rank 1 and 2, so we'll put our most concern right in that area to make sure we get that right before we go ahead with any other part of the program. And then where we thought we might see more of the environmental concerns and the caregiver, the next one was out here by number 5, the scorekeeping. And one of the reasons for that is the discussions around this one were very interesting, in that what happens if you have numbers, now all of a sudden it clicks in over here at operations and finds its way and reports to the C-suite. So it's an important thing to consider these. So what are you going to do after the hurdles? Let's take a look at our next exercise. And now, considering the information that we just gained from the hurdle exercise, let's take a look at this one. What we're doing here is estimating the risk and the frequency of the hand wash. On this axis, we have the healthcare acquired infection risk. Over here, we have the hand washes per hour. If we look at hardly any hand washing, our risk is probably way up here. It'll never be 0, so we'll be choosing an area there. So where do you think it is today? We frequently find that people are finding their hand washing, let's say right in there, borderline high, more or less a moderate risk. And when we ask, well, where would you like to be? It's never going to be 0. Where should we put it? Often we're finding people choose numbers right in here, low risk, bordering low, very low. So this is an area where we start putting some dimension on the risk of hand washing. There's an acknowledgement and we're not where we want to be. Let's try to decide how to get to that spot. Later, we'll be able to translate the hand washes. We'll find out first what our current rate of hand washing per hour is. We'll put that under here. And then we'll look to see what a future one to get us into this area. So this can be very, very helpful in deciding where we're at, what we have to do. And that leads us into the next drill down, another piece of the circles of success. Here we're going to drill down. You recall those 5 steps of assessing the risk, setting safe levels, optimize, train and motivate, monitor. We're going to drill down here by going into each one of those and see how we're doing. Are we asking the right questions on risk? Do we talk about risk specifically about hand washing, or is it mixed in with everything else when we're talking about patient safety? So this is something we invite the participants. Let's say we have 4 participants in this study, and they'll come up and say, well, I think the way we're looking at risk, I don't feel very good about that. I think it's probably in this area. The next person might come out, I don't think it's that bad. I think we're probably more in here. The third one might come up here and say, I think we're worse than all of it. So each one of these things creates the discussion where people defend where that is, and they'll come up with one final view of what our number is for each one of these tasks. So we'll take this, repeat it until we're through with the 5. Then we'll start creating the Handwashing Risk credit score number. We'll do that next. Now that we have a consensus on the numbers, comes the fun part. We're actually going to calculate your Handwashing Risk credit score. Now everyone, the 4 votes that we had, they were a pretty tough group, and they felt that the assessing of the risk side here was really left wanting, in that we talk a lot about risk in general terms, but don't take it and connect it directly to the hand washing. So that number is 500. So the next one was also pretty tough to set safe levels when we don't have levels right now. The group felt that a number of like 540 was about where we were, so that too is in this circle of highly dangerous. When we got to the third one, there was some positive vibes for some of the recent investments in hand washing, and so that earned a 620 in that, into the safety is threatened, but now we're getting closer to the safe center with a vote of that. Now at 680 it came in for the training. Now that's something where the feeling generally is we've got good trainers, so training based on what we're seeing and feeling, we're doing pretty well. Then the last one of monitoring, we do have a very good observation monitoring system and program in place. But we're also very aware that so few, it gives you so few records that area needs attention. So they too gave it a 540 in that circle. So now what you do is simply add these numbers up and divide by 5, and you'll get your final hand washing risk credit score. In this case, it came out 594. Now, when you think of going through this exercise, we have one final step, and that's to apply what you can do when you do have data. Here's a chart that will show you just what you could do when you have data. Here we have a case where we have 4 units, and the baseline of hand washing is around the 40% mark. Did some in-service training over the first couple of months, and then it started to taper off. And this is what we call the training ceiling. It's a point that you reach. The training just alone can't take you any further. So then what happened here? Out at 6 months, what we're doing is marching this up. We're looking to rise from 40, 60, 80. We'd like to get to 90. We'd like to get to 100. So here's what happened at 6 months. We changed the reporting. Instead of reporting just the individual units back to that unit, we started reporting into all 4 units. Each one looked at it. No one wanted to be the bottom. We had accidentally built in an incentive to keep the performance on the move. So this is an area to really remember the competitiveness that turns out to be a very, very good help in maintaining the monitoring without a lot of coaching and a lot more in-service training. So there you have it. We start out with a system of circles of success. We've got a few simple, easy to execute pieces or exercises, and we end up with some information of what we should do next in moving forward to lower our infection rates. Thank you.